I read a randomized control trial for children with childhood apraxia of speech comparing rapid syllable transition treatment and the Nuffield Dyspraxia Program, 3rd edition. These programs are known as REST and NDP3 throughout the conversation. This study compared the two approaches for treating children with childhood apraxia of speech. Children ages 4 to 12 may benefit from these treatment approaches. It is interesting to me because I would like to be able to help people in this population to be able to communicate as effectively and efficiently as possible. They tested the effectiveness of the REST program against the NDP3 because it is the most commonly used treatment in Australia and the United Kingdom. They hypothesized that treatment effects would be similar for both treatments. REST treatment would result in greater maintenance of treatment effects and in greater generalization of treatment effects to untreated words at 1 and 4 months post-treatment, compared to NDP3 due to the high target complexity whole task activities of the NDP3. The authors delivered treatment to 26 children with mild to severe childhood apraxia of speech ages 4 to 12. The treatment was delivered 4 days a week for 3 weeks at a university clinic by supervised SLP students. Articulation and prosodic accuracy were assessed. The authors concluded that the NDP3 had greater accuracy on treatment items in comparison to the REST treatment. They also concluded that the children that received the REST treatment did show strong maintenance of treatment gains up to 1 and 4 months post-treatment. The third hypothesis that the REST group would generalize the effects of treatment to untreated primary outcome more than the NDP3 group was partially supported by the study. Both groups improved similarly for untreated real words. The participants were randomly assigned. The treatments were provided according to their respective manuals. The clinicians received training prior to therapy, and the caregivers were blinded to the name of their treatment their child was receiving. The parents were able to observe sessions through a one-way mirror and discuss with other patients' parents in the waiting room, so those may be limitations to the study. Both treatments seem to be effective and have their strengths. Because of the complexity of the NDP3, the REST treatment approach may offer stronger generalization for children with childhood apraxia of speech. I would like to investigate more about both REST and the Nuffield Dyspraxia program.